Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Janhvi Patel. She's the lead for digital ventures at Memorial Sloan Kettering Cancer Center. So great to have you with us.
Thank you so much for having us.
So you are relatively new in your position, I understand. And so give us a sense of what Memorial Sloan Kettering is looking for when it comes to digital partnerships. Like, what are you guys looking for? Is it all cancer related? Is it different things? Give us a sense.
Sure. So I joined to lead digital ventures, and what that means is I manage their data, AI, and software innovation portfolio. So it is a new position, and that's because a lot of advances in technology and how we use data are really going to be some of the driving forces of how oncology is treated and also how we control costs moving forward. We're looking at, both internal innovation and also external innovation, which is really going to be key in digital health. And so there's various different kinds of ways that we kind of think through, what type of engagement model might make sense based on, what we want to kind of pursue.
All right, talk a little bit more about that, because there's a lot of different types of strategic investors in organizations, in big health systems or in big hospital systems. And so talk through how your model is set up. So it's not necessarily ingrown in-house innovation, and it's not necessarily all from outside. You kind of have a hybrid mix, right?
Yes, we do. And that's because I think the expertise that is required to really kind of innovate in digital health requires kind of some of the expertise that we have in-house. So, our clinical research experts, our data assets, our understanding of patients and diseases. But it also requires a lot of expertise that we don't necessarily have in-house. So machine learning experts, data scientists, software engineers. If you've tried to hire any one of these folks recently, you know that the market, is there's a great demand for them. And so that's why we look at innovation both internally and also external innovation, and we look to really focus on, in certain areas, partnerships where we can kind of take the best expertise in these areas to kind of really help push forward a focus in certain areas. And so areas that we're interested in are precision medicine, so leveraging various different AI capabilities and data assets to kind of really push the envelope when it comes to looking at diagnostics. We're also looking at digital health tools in patient care throughout the patient journey, and also looking at interesting ways that we can innovate in care workflow innovation.
Okay, on that last one, innovating the workflow side of things, what can you give us a little bit more there, so we can, if there are any startups out there watching who are like, ooh, I might be in this space, so what kinds of things there are you looking at?
Sure. So I think one of the key things, and you hear it a lot, is like physician burnout and kind of trying to make the patient experience and also the physician experience better with technology. So looking at transcription kind of technologies, communication applications that really kind of help support further engagement between a provider and a patient, and really kind of help advance that relationship and the conversation.
So for the startups that might want to engage with you guys, so what should they expect, and what is the best way in? Are you the way in? Is this it?
Yeah, the great thing is there's a lot of different ways. The way that we think about partnerships, they could be strategic alliances where you're partnering and, we're bringing in our expertise and our resources, and they're bringing in, their resources to work on really big picture problems. And so in those kind of scenarios, working with someone like myself or someone from the tech development office is a great way to pursue kind of larger collaborations. There's also very focused kind of projects that we might want to, a startup might want to, or a company might want to work on. And in that scenario, obviously coming through, the digital ventures or technology development office is really great, because they have a great overview of what is occurring at the hospital, but specific researchers are actually a great avenue in. So if you look at particular projects or use cases that you're really interested in, reaching out to those primary investigators and those researchers and really defining that use case and that project before you come to corporate is a great way to start, because you'll just be able to kind of really understand the purpose, objectives, the engagement model to bring that conversation forward in a much more a faster way. So there's a couple of different ways to approach it, and I would really highly recommend considering both based on what the opportunity at hand is.
I love what you just said about engaging the clinician or the researcher that's involved in that. And then I guess from my question to follow on that would be like, so from your perspective then, as somebody who's then part of the corporate side of Memorial Sloan Kettering, it has to hold a little bit more sway then, right? When the clinician or the researcher brings a solution to you, I would imagine.
Yeah, it happens all the time, and the one of the best benefits of that approach is, just a better definition of what it is that both parties would like to work on. So really kind of defining that use case and that project and the objectives and the goals, it's just much more precise and specific. And if that's kind of the focus of what the engagement or collaboration would be, working with a researcher is great to do that.
Last question for you. In terms of some of the solutions that you've been, coming across as you've been doing this, so you've got a different kind of background a little bit. So touch on that. But I mean, as you're looking at this space and you're looking at, some of the tech that's coming along, I know you're not just looking at startups. You're even looking at bigger companies to partner with. Is there anything that you really, if they're out there listening, that you're really excited to see a little bit more of, either a type of solution or a potential partner that you're interested in working with? What might that be?
Yeah, I think one of the most fascinating things right now is just further development and curation of real world data, and being able to use real world data to support various different use cases and applications to kind of improve patient applications in health. So I think there's a lot of interest to kind of understand how we can draw further insights to develop and drive innovation in that specific area.
Awesome. Well, good luck in your new role. Thank you so much for joining us. I'm Jessica DaMassa with WTF Health. Thanks for watching.